Thank you very much, Stefano. Really, the opening was quite meaningful. I think it projects the growth of clinical engineering as a whole. What we'd like to do this morning is, throughout this IUPESM workshop, is to showcase some of the development in the area of biomedical engineering as well as medical physics. So for some of you who are not familiar with IUPESM, IUPESM basically is an umbrella organization that brings together the biomedical engineering as well as the medical physics physicists, basically, through IFMBE and IOMP. So both IFMBE and IOMP, as you know, may or may not know, are actually in official relationship with WHO as one of its non-governmental organization in partnership with a number of the activities that they have. Let me just, oh, it's got stuck somehow. Can you move? Are you able to move forward? Yeah, just to let you know, also the International Union for Physical and Engineering Sciences in Medicine is affiliated to the International Science Council. You may not know this, but IUPESM will be 40 years old next year in 2020, and we're planning quite a number of celebrations. The next speaker, Professor Slavik, will talk to us, but he is the Vice President of IUPESM, and he's also the chair to organize the 40th anniversary of the union next year with a number of activities, and quite exciting one too. IUPESM has a journal. It's called the Health and Technology, and I would encourage you that if you have articles in the area of clinical engineering, or health technology management, medical physics, to encourage you to publish in this journal, which is the publisher, of course, is Springer Nature. The flagship event of IUPESM is the World Congress on Medical Physics and Biomedical Engineering. This is a triennial conference or congress. The last one last year was held in Prague. It was a very successful event. The next one, which is in 2021, will be in Singapore. So you're all welcome to participate in this World Congress, and I look forward to your participation in terms of perhaps organizing some interesting symposium or organization. The event, just let me talk to you a little bit quickly about the event. It will be held in the Marina Bay Sands. It's one of the most iconic buildings in Singapore, with a boat right on top of the three buildings. I'm sure you have seen this photograph many times around. It's got a 400-meter swimming pool on the top that you can enjoy. So we've actually locked in our room rates with the hotel for the 2016 rate. So if you were to book now, you twice the hotel rate that you actually find for 2016. So it's a real deal for us. Singapore actually has got 160 countries that have signed agreement for free visa entry into Singapore. So I think most nations around the world will be able to get in very easily. We have about over 300 cities connected to the country, and some of you may have heard that there's a lot of development in terms of creating the airport as an interesting entertainment hub as well. It's also easy to get around in Singapore. We have ride apps like Uber, similar to Uber. You download the app called Grab, and you can basically go anywhere in the world. It's also quite close to a lot of regional getaways. Within 2 hours, you are into Vietnam, Philippines, Thailand, Malaysia, Cambodia, Bali, Indonesia, and all that, so if you're interested. Now, let me just come back to the topic of medical engineering and medical physics. So particularly, as you know, the growth of the medical device industry is rapidly growing. This is a This is a forecast from this consulting company called EvaluMedTech, which forecasts that by the year 2022, the medtech sales would have grown up to about $500 billion, US dollars. So it's a rapidly going in the area with a number of the, as you can see on this chart here, there are about these 10 device areas that are growing very rapidly, with some of which the growth rate, the annual cumulative growth rate is around about 5 to 6%. So this is a really a high growth area, so particularly in vitro diagnostics, cardiology, as well as endoscopy. The diagnostic imaging as well, as you can see on this slide here. Now, what is driving this growth? Of course, aging population is one in a lot of the developed countries. This is a big issue. Consumerization as well, and rise in chronic diseases, shortage of healthcare workers in some of the developed countries, and as well as technologies that's been developing around, over the last decade or so in the area of the various omics that we know, genomics, proteomics, even nanotechnology that has brought in a lot of changes to the way technology as we understand it, and also the application of this technology to healthcare. I won't talk very much about this because in this Congress there are a lot of discussion on digitalization of healthcare, and this has been through the use of machine learning, AI, and all that. So scientific and engineering innovation will definitely change the way healthcare will be like in the future. One of the most important aspects of all this is, and has been reported quite frequently in the press and in other media, is the whole area of cybersecurity. In fact, in Singapore, we have one of our largest hospitals. The data of 1.3 million patients stolen just last year. And one of the patients happens to be our Prime Minister. So it's causing great concern. So I think moving forward, I like to just quote this statement taken from Young's and Ernst's publication, Pulse of the Industry, put out in 2018. So basically, he's saying that digital technologies will only achieve their potential for patients and healthcare systems if public policies are in place that promote innovation along with patient safety. So I think this is a big role for clinical engineers to be able to ensure that this kind of policies are put in place to safeguard our patient and also our innovation. So I just don't want to go through this, but as you know, there's a lot of innovation that's happening around the world. But I'd like to bring back to you that with all this innovation and progress in technology, one of the things that I'm particularly concerned about is our education, our training. Are we training people or students, putting a square peg in a round hole, so to speak? So should our curriculum be evolving all the time to ensure that students are trained with relevant skills for the industry, for the future industry that are moving in. So I'm glad that Slavik and the rest are going to talk a little bit about this education in this session. So IUPESM is a great platform, I think, for collaboration in physical and in engineering sciences in medicine. So this is where I'd like to thank the prime mover for this workshop. The first one was held in Taipei in April this year. And this is all the effort, initiative of Magdalena, whose youthful enthusiasm, I always appreciate, and as well as KP Lin, who together put up the first medical engineering and physics workshop in Taipei. So this is the second one that they put together, together with the help of Leandro, to acknowledge Leandro's help in putting this together as well. So as you know, you have the program with you, and I'm looking forward to a very exciting program in this workshop. So with that, I'd like to thank you very much for your participation, and I hope that through the different talks and sharing, there will be a lot of exciting discussion and suggestion that will come forward. First off, I'd like to invite Professor Slavik to the podium to give his presentation. Thank you very much.